Hi, Sam here, and I am submitting my second of 4 videos for our appendicitis assignment. This is the critical appraisal of a randomized control trial, in this case the Vaughn's Lancet 2011 control trial. So I'm going to be using the critical appraisal of randomized control trial template that was submitted in that was presented in lecture rather than the one that's in our JAMA book. So the first question in this template is, what is the question that the trial is addressing? So what is the PCOS? In this case, the patient group, or the P, is adults examined in the emergency room and suspected to have acute appendicitis and are confirmed to have uncomplicated appendicitis by a CT scan. The intervention here, or the I, is the antibiotic treatment group. If symptoms persisted, an appendicectomy was undertaken at 48 hours. I'm going to call this an antibiotics first group. The comparator here, or the C, is appendicectomy according to surgeon's standard practice and 1 injection of the same antibiotic used in the intervention group. I'm going to call this an appendicectomy first group. Important to note here that I'm just using these terms for ease, and I'm not at all implying that this was a crossover trial. So the outcomes here, or the O, the primary outcomes is the occurrence of peritonitis within 30 days of treatment. The secondary outcome, there are a few. The first is number of days with a post-intervention visual analog scale pain score of 4 or higher out of 10. So this relates to the pain of the patient. The second is the length of hospital stay and the absence from work. The third is the incidence of complications other than peritonitis within 1 year. And the fourth is recurrence of appendicitis after antibiotics. In the study design, this is an open-label non-inferiority RCT. So that is my PCOS, or my question. The second category I want to look at, the second step of this template, is, are the results valid? And this relates to internal validity. So did the groups start the trial balanced? Were they randomized, and were they truly randomized? I say yes, because the authors say that this randomization was computer-generated randomization codes and opaque envelopes, which seems truly random to me. And was the randomization concealed? I said yes, because it didn't seem as though those enrolling patients had any control over which arm to which they were assigned. Next, I want to look at if there was intention to treat population for their results. And for this, I say yes. All patients who were randomized and started treatment were included in the intention to treat population here. This seems reasonable. Authors may want to include those who didn't start treatment as well, given that they may have differed systematically from those who did start treatment. But this wouldn't have I don't think this would have made a large difference, because it was only about 4 of 243 subjects. So, and overall I say yes, this was well done intention to treat analysis. So, also, all the results presented for the primary and secondary outcomes are based on the intention to treat population, which is good. So the next thing I want to look at is, are the baseline characteristics similar? And this can be seen in Table 1. For the most part, they are. The only item that jumped out at me as being concerning was the lower right quadrant rebound tenderness, and this was found to be 62% in the appendicectomy group versus 48% in the antibiotic group. However, this was only 1 out of 13 items assessed in the Table 1, which seems reasonable. Also, this trial seems to have been truly randomized, so it can be concluded that this one significant difference was due to chance alone, just based on the fact that it was randomized. So, did the groups remain balanced after the study started? The first thing I want to look at is, was there blinded allocation and ascertainment of outcomes? There was no blinding for patients, clinicians, nor assessors. This trial was not blinded at all, in that the authors say that it was an open-label trial. However, it's not reasonable to think that blinding would have been possible, as the intervention was a drug and the comparator was surgical. So, I want to look at next whether follow-up was complete, and in this case I say yes, because this trial was not stopped early. However, it should be noted that approximately 15% of the patients were lost to follow-up, or excluded following a CT scan. although there are not many, there isn't a sensitivity analysis in this paper, there are several sensitivity analyses presented in the web appendix. So in the analysis that excluded missing data, the difference remained similar to the intention to treat population and significant. And the authors also did a worst case scenario analysis whereby they said that missing data were counted as having had peritonitis within 30 days or counted as having had their primary outcome. In this case, the difference became lower, 5%, and was not significant, with a confidence interval of negative 2.3% to 12.4%. So the next question I want to look at is, are the results important? So what is the magnitude and the precision of the effect? For the primary outcome of 30-day post-therapeutic peritonitis, the magnitude of the effect was 5.8%. So it was 5.8% higher in the antibiotic group than in the surgical group. And this estimate seems reasonably precise in that the confidence interval was 0.3% to 12.1%. Now, given the low number of events, there were only 2 events of peritonitis in the appendicectomy group, and 9 events in the antibiotic group, this low number of events has a larger effect on the confidence interval width than does the sample size. It widens it, or makes the estimate less precise, I should say. So given that there were few events, and given the size of the confidence interval, regardless of this, I think that this is a reasonably precise estimate. So the next area I'm going to move on to is, are the results applicable? And by this I mean, is the study externally valid? So are there good reasons to say that these results do not apply to my patient? Now, for answering this, it's important to note that I assumed in this case that my patient was the 12-year-old that was presented in the assignment. So the patient population for this trial was adults only. The patient in my case, is 12, so the results may not apply just based on age alone. However, for the purposes of creating general guidelines, the exclusion criteria do not seem to exclude any important groups. So if I'm trying to make a decision, it doesn't seem like the patients differ systematically from general population. So I think this trial can be used for the purposes of looking for creating guidelines for adults, but maybe not for children. However, I think it's important to note that realistically it might be difficult or maybe even impossible to conduct a trial like this on 12-year-olds. So trials focusing on adults may be the best available evidence in this case, and I'm going to go ahead and assume that it is, just based on the other trials we've seen as well for this assignment. So especially since the child is otherwise healthy, in that the assignment says he's in excellent health, I think that it's reasonable to generalize this trial to him if no other well-designed trials focus on children. So the last thing I want to look at is, are the results worth it? And by that I mean, are the benefits worth the risks and the costs? In this case, the results of this trial showed that the primary outcome of peritonitis was significantly worse in the antibiotic group than in the surgical group. Therefore, there are no benefits that I can see to using antibiotics first over appendicectomy first. And I agree with the authors that appendicectomy ought to remain the gold standard for acute, uncomplicated appendicitis, I should say. So in this case, I would rest easy knowing that I had sent this patient to surgery rather than giving him antibiotics. And one final assumption that I want to make clear is that I'm assuming that appendicectomy is the same thing as an appendectomy. A brief literature search told me that they are synonymous, and I'm going to proceed with this assignment as if they are. Thank you very much.